Hi everyone, my name is Stephanie Send. I am a registered dietitian and nutrition educator, and I'm very excited to be talking to you all today about cultural competence, practical implications for NFPE. So just a brief introduction. By the year 2044, more than half of the US population will belong to a racial minoritized group. So it's important to consider that these groups may have higher prevalence of chronic conditions that we're facing today in our country. And these chronic conditions have significant nutritional implications. So healthcare workers and dietitians in particular need to be aware of the diverse healthcare needs for our patients. So using cultural competence as a tool can help to foster a sense of mutual respect between the clinician and the client, which ultimately leads to better patient care and better patient outcomes. And I also want to note that cultural competence should be something that we're working on continuously as the world is evolving, and so is our practice of dietetics. So when we talk about culture, this expands beyond race and ethnicity. So other examples of cultural identities are social identities, such as age, sex, gender and sexual orientation, religion, class, and ability. So I want to touch on the Campinha-Bacote model. I thought this was a really interesting kind of five-step model for cultural competence. So I'll walk you through these 5 steps and then provide an example of how this would apply to the dietetics practice. So the first step is awareness. This is understanding personal cultural identity and then also identifying one's self-biases. So a good example of this is, as dietitians, we know that dairy products are a great source of calcium. However, there are a lot of populations that have lactose intolerance, such as East Asian populations and African American populations. So considering this is really important and being aware of our, gut reaction to recommend dairy products as a significant source of calcium to all of our patients requiring additional calcium. The second step is knowledge. So knowledge is seeking out tools and education to better our understanding. So a good example of this is staying up to date with statistics for chronic diseases. So understanding that Hispanic or Latinx populations may have higher risk of certain types of cancers, cardiovascular disease, and type 2 diabetes. So considering this is really important when you're working with those populations. Skill is our third step, and this is the ability to identify potential healthcare concerns and leverage this information when performing our nutrition care. So an example here would be when completing your NFPE, you may note dry skin on an African American patient. And something to consider is that this is very common for African Americans to have dry skin. So this might not necessarily be a sign of essential fatty acid deficiency or dehydration or micronutrient deficiencies that we associate with dry skin completing an NFPE. The fourth step is encounter. And this is seeking out opportunities to engage with diverse backgrounds. So an example of how a dietitian could implement the fourth step here is by volunteering in different areas where you can be exposed to other populations that may not be your traditional client that you work with. So just really gaining more encounters and more opportunities to work with those that may have a different background than you. And then the fifth and final step is desire. So this is the motivation to engage in ongoing cultural competence. So I discussed this is an ongoing continuous process. So really seeking out these opportunities is really important. In ways that dietitians can do this is becoming a member of a multidisciplinary board, focusing on cultural competence, or perhaps training or mentoring younger, newer clinicians to perform cultural competence in their nutrition assessments and particularly NFPEs. So let's dive into the NFPE piece a little bit more. So nutrition-focused physical exam, or our NFPE, Just as a brief refresher on this, this is dietitians perform these subjective assessments on clients to obtain information on potential macronutrient and micronutrient deficiencies. So the NFPE complements the findings from our other steps of our assessment, including anthropometrics, biochemical data, and dietary assessment. So areas that we're observing during the NFPE on your client's body are the orbital region, the triceps region, the ribs, or the iliac crest when we are looking for changes in subcutaneous fat stores. And then the temporalis, deltoid, trapezius, and quadriceps regions as some examples of places we would be assessing for changes in muscle stores. We can also look at hair, skin, nails in the orofacial region to assess for micronutrient status. So key factors to consider when we are performing an NFPE utilizing cultural competence skills is that macronutrient deficiencies or micronutrient deficiencies that we would see within these NFPEs can be more prevalent in persons coming from specific social identities, which we'll talk about in a minute. And then also noting that self-boundary and response to physical touch is different for everyone. So we need to approach this with that in mind and respect for our clients. So some considerations when we think of various religious and cultural backgrounds. So there are many religions that participate in fasting, such as Islam, the Church of Jesus Christ of Latter-day Saints, Catholicism, Judaism, and Buddhism. So for these religious backgrounds that may participate in fasting, there potentially can be some nutritional implications, such as weight loss, dehydration, and micronutrient deficiencies, specifically those water-soluble vitamin deficiencies due to our body not storing these vitamins for long periods of time. When we consider the aspect of different religions or cultures on other aspects of eating, such as restriction or elimination of particular food groups, we need to consider that. So perhaps different religions such as Catholicism, Seventh-day Adventist, Greek Orthodox Christian, Islam, Judaism, Buddhism, or Hinduism, these groups may exclude food groups such as meat, pork products, beef products, eggs, dairy, and so forth. So the nutritional implications of removing some of these food groups may be the result of or present with nutrient deficiencies such as vitamin D, iron, B12, or calcium. So considering this when you are working with your client. And then outside of religion, those living in different areas of the country or identifying as one of those other cultures that we discussed, that may influence their dietary patterns and present with a dietary pattern that is not considered traditional to our Western culture. So keeping all of this in mind and understanding your client's cultural identities before going in for that nutrition-focused physical assessment can be really key to help you hone in and identify potential nutrient concerns. All right, so what might we observe if some of these nutrient deficiencies of concern are present? So things to look out for when completing the NFPE that would indicate signs of inadequate energy intake would be the loss of subcutaneous fat stores in those areas mentioned before, as well as signs of loss of muscle stores. Signs of dehydration could include poor skin turgor, the tenting of skin, or dry mucous membranes. Signs of protein or iron deficiency could include the thinning or dullness of hair, pale skin, as well as spoon-shaped nails. Signs of B12 deficiency could be angular stomatitis or chelosis. It could also be a beefy red or a pale tongue, or it could present as peripheral neuropathy. Signs of calcium deficiency could be muscle twitches that a patient notes, and signs of vitamin D deficiency could be swollen gums, Could be dental caries, muscle cramps, or rickets. Talking about those physical touch considerations. So it's really key and important to ask your client for permission and explain the rationale of your nutrition-focused physical exam prior to starting the assessment. Patients may wonder why this is important for their overall nutrition care. So if you can provide that explanation and ask for permission, this can really help to develop a positive relationship with your client. And then there are some religious beliefs or different cultural beliefs where individuals may have certain areas of their body covered, such as the arms, the leg, or the hair. So respecting that and considering that we may not be able to assess those areas of the body during the NFPE. And it may be against some cultural or religious beliefs to have a clinician of the opposite sex assess the client. So considering that in making alternative arrangements for NFPE to be completed, if this may be the case. For mobility considerations, recognizing that those with limited mobility may require a modified physical exam. So we may not be able to complete a head-to-toe full comprehensive NFPE. When someone may have limited mobility, some good focus areas to include in your NFPE could be the orbital region to assess for subcutaneous fat loss, and the temporalis, the pectoralis, the deltoid and trapezius, as well as the interosseous muscles within the hand to assess for muscle stores. So really focusing on the upper body for those with limited mobility. Hair, skin, and nails in the orofacial region will allow for detection of micronutrient status concerns. So if you are able to get an upper body and facial NFPE exam, you can also identify any signs of nutrient concerns in this area. And while we recommend completing a bilateral physical exam, it's important to note that this may not always be possible due to patient mobility considerations, as well as if a patient has paralysis or neuromuscular conditions that may cause some unilateral subcutaneous fat or muscle loss that is not nutrition related. So always considering your client's mobility as well as pre-existing conditions that may influence their muscle and fat. Sensory considerations. So for patients that are blind or visually impaired, it's really key to use verbal communication throughout every step of your nutrition-focused physical exam, as well as if clothing is removed or moved, asking permission when doing so as part of the exam. If you have a patient that is deaf or hard of hearing, utilizing interpreter services, so having an interpreter present with you when completing the exam to make sure your client is aware of all of the steps involved in what you are doing within your NFPE. And then racial considerations. So as we discussed before, there are different racial and ethnic groups that are at higher risk for chronic disease as well as malnutrition. Therefore, completing a comprehensive NFPE on these clients is key to help identify and treat that malnutrition or other chronic disease and nutrition-related concerns. So some examples of this are things you may see within an African American population could be xerosis, or that dry skin that I had mentioned before. Vitamin D deficiency is common in African Americans, so looking for signs of vitamin D deficiency when completing your NFPE. And then acanthosis nigricans is common in both the African American and Hispanic populations. So if you see the presentation of this skin within your NFPE, doing a further investigation of this and potentially looking for insulin resistance or bringing this information to your team would be really vital. When working with a client with an obese BMI, it's important to remove biases associated with overweight or obese weight status and the presence of malnutrition. Weight status does not directly correlate with malnutrition status. So patients that present with an overweight or obese weight status, we should absolutely be performing a full NFPE to assess for any signs of malnutrition. In areas that can be easily assessed and are really important to assess for rapid losses of subcutaneous fat and muscle stores would be the orbital region, the temporalis region, the pectoralis region, and the deltoid region. So discussing this information, we may consider the barriers for implementing a culturally competent NFPE exam. So some of these barriers would include inadequate or limited access to training. While NFPE has been around for several years, there may be parts of the country that have limited access to training programs. And so if we do not have adequate training or limited access to training for dietitians to become competent in these skills, that could be a barrier. Confidence. Newer clinicians may be less confident in their NFPE skills than seasoned clinicians, so considering that as a potential barrier. Some clinicians may be uncomfortable with performing the NFPE due to discomfort with physical touch. Clinicians may have had limited contact with culturally diverse populations, therefore also decreasing their confidence within this area. So why is a culturally competent NFPE exam so important for our field? We need to consider the core competencies for our profession. So some of the core competencies for dietetics education and registered dietitians are being able to conduct an NFPE, being able to perform their duties of their job with cultural humility, having strategies that are culturally sensitive and addressing cultural biases and differences, and then self-assessment of learning cultural orientation and developing goals for self-improvement is within the core competencies for our field. So as you can see, this is a focus for our profession and therefore something we should always be working on continuously as registered dietitians. When we consider the ACEND standards for dietetics education, and the future education learning model, learning activities that implement the nutrition care process with various populations and diverse cultures. This is one of those ACEND standards, as well as learning activities that build in the opportunity to develop competency in diversity, equity, and inclusion, as well as the development of skills that recognize self-bias. So for those working with dietetic students, it's so important to allow your students the opportunities to work with patients coming from diverse backgrounds, and then also implementing these opportunities for areas to develop their competency when they get into their field placements and are really working hands-on with their clients. So in conclusion, as you can see, there is a benefit for both the client and the clinician by developing cultural competence in infusing this within your nutrition-focused physical exam and overall nutrition assessment. When we prioritize cultural competence, this helps us to enhance the knowledge and understanding of others. And when we understand our clients better and make a significant effort to do so, this helps the client feel more respected. The client will be more engaged in your assessment and nutrition care plan, and they'll feel like they are a part of their own medical care and part of their healthcare team, which ultimately improves client outcomes and patient care. Thank you for sharing this time with me and taking part in the conversation around cultural competence. We look forward to seeing you in the next one.